What is foundational medicine? How is it different than functional medicine? No, don't get me wrong. I'm a certified functional medicine practitioner. I got my certification at the same time I was getting my chiropractic license in 2017. Because I graduated with both my license and my certificate the same month. I had a baby and became a mom. So I was a busy, busy girl in March of 2017. So foundational medicine versus functional medicine. Let's take a look at the differences here, because I believe functional medicine has a lot of rabbit holes. So we're going to call this one functional med. We're going to call this side foundational med. Okay. Now, functional medicine, you get into what we would say is the root cause, right? What's the root cause of migraines and the root cause of PCOS and the root cause of gut issues and the root cause of chronic fatigue and blah, 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 blah. Look, that's worked for 30 years, maybe 40 years. It doesn't quite work for very many anymore, because here's the problem. One practitioner, sorry, let me get my words correct here. One patient can go to 5 different, quote, functional medicine physicians, and they're going to get told 5 different things. That's 6 lines. 5 different things. I don't really care if you're a muscle tester or if you have a specific technique that you use. It is not consistent across the board. And I have been talking to this about this concept with multiple people. In fact, I was at did my brand photo shoot in September, and I had the 2 makeup artists come and do my hair and my makeup. That's not my specialty in life. And I sat down there, asked me what I did. I said, well, I'm the CEO of the Foundational Medicine Institute. Like, well, what's that? What's your mission? So our mission is to fix a broken industry. Yes, we all point fingers at Western medicine when we are just as broken. That's the bottom line. Because at least Western medicine has a standard method of care. You get a diabetic diagnosis, you get whatever the heck the drug's name is. You get fibromyalgia diagnosis, you get Lyrica or whatever the heck the new drug is. Like, there's a standard method of care, whereas one patient can go to 5 different alternative healthcare physicians, get 5 different reasons why they are in the situation they are, 5 different treatment plans, 5 different investment opportunities, and how do they know which ones to pick? How do they know which one is right? And it's funny because I told these 2 women, and they're like, oh my gosh, I have a story for you. One of them, they're both young. They're both probably my age. And the one has 5 kids. And she said, I went in to get an adjustment. I didn't know this, but over the course of the next month, I would experience 22 strokes. Call it a fluke, call it whatever you want, but it's real. She was in the coma for a month. Meanwhile, her husband and 5 kids are at home. The other one was like, I don't know who to trust. I don't know if I could trust alternative medicine people. I can't trust Western medicine people. So I can't trust Google either. I don't know who to trust. So what's your story? And she said, I've got a kidney problem a kidney prolapse since kids, just 3 of them. And she said, one person told me to use a doTERRA essential oil and put it up my urinary tract, and it was going to solve my bladder. How is that any different than being put underneath the microscope? The needle. I don't know. Okay. I told this story to another person, and like I said, my goal is to fix a broken industry. My goal is to have Western medicine on this side, functional medicine on this side, and foundational medicine parallel the 2 of them. Why? Because we're combining blood work with what the body really needs to heal. We're getting back to the foundations of what our bodies need to heal, not crazy charcoal detox things, and I don't know what else is out there. I don't even want to know what else is out there. because this person said she took a zinc supplement that was recommended to her, had a terrible reaction, so much so that she ended up in the ER with hives all over her body. And it threw her off. She believed that was a big part of her miscarriage, this therapy that she got put under. And so again, she's like, I don't know who to trust. Because you go to this person, they say it's this. You go to that person, they say it's that. And you go to Western, like, get my picture here. Foundational medicine. What do the cells need to heal? What do the systems need to run? How do they talk well together? Use the blood work to monitor everything. That simple. You know, as I've been a clinician in my patient world, and people would say to me, well, what do you do for this? What do you do for that? What about these lists of symptoms? And for the last 6+ years, I have never given a crap about symptoms or a diagnosis. Why? Because the blood work has the answers that I need. Something went wrong in the cells. Something is going wrong in the systems. They're not talking well together. Getting back to the foundations of medicine, getting back to the foundations of what the body needs to heal, that's where the future is headed. So I want to invite you to come into this world of foundational medicine and see how not only simplified and easier it can help you in your practice, but how it can help many others as you go and serve them. Okay? So the difference between functional medicine is finding all the root causes and know there's not just one for one certain thing. That's why if you Google how to remove migraines, you're going to get trillions of answers. Or why you Google how to lose weight, you're going to get trillions of answers. To think that there's one root cause for things is you're out of your mind. And then to think, wait, do I start with gut? Do I start with hormones? Do I start with detox? Where do I start? Complex road. And we've seen over and over and over and over again how it is taking practitioners down. Brilliant practitioners whose goals are to just serve people and to help them get better. And because we made it so complex, everybody I've talked to, and I've said what my goal is with foundational medicine, they say, please, somebody needs to fix both industries. So, foundational medicine, getting back to the foundations of what the body needs to heal. We're talking about cells, we're talking about organs, we're talking about systems, making sure they all communicate well together. Oh, and by the way, the blood work that your regular doctor orders, has the tools that you need, because it's just the person whose body has gone unhealthy, and you got to help them get healthy again, and then get them from unhealthy to healthy to extraordinary. It's the foundations of medicine. And there's a reason why I'm pretty sure it was Hippocrates who used it many, many years ago, hundreds of years ago. He was using this blood work, these markers, getting back to the foundations. Okay, and I've got a book coming out explaining both the business one, which is one book, and that's coming out first, and the clinical side, which is the second book of the series. It's coming out second. So look for a foundational medicine, the business blueprint to serving 10,000 patients. That's book one, coming in Q1 of 2025. Book two is the clinical blueprint to serving 10,000 patients. And that's coming in Q2 of 2025. Okay, but you don't have to wait till then to get answers. There are 3 ways that you can come join Foundational Medicine Institute right now. The first is it's free. It's a live workshop with me on October 22nd, 23rd, and 24th from 1 to 3 p.m. Mountain Standard Time, which is 3 to 5 p.m. Eastern. You do not need to attend all 3 days with me. Just come join one day, because we're going to workshop. I'm going to laser coach anybody who's on the live call with me right then and there. I'm not presenting anything. I'm just going to laser coach you. And I'm going to ask the main question everybody wants answered. What do I do next? So if you want to know what should you do next, register at next.drkylieburton.com and come join me on this live and free workshop. I don't know if I'm ever going to host it again, so you might as well come join me now. The second one is our 10,000 patient sprint. This is a 90-day program where we dive into the foundations of building a business, from the programs, which are most important. You got to know what you're selling, and you want to make sure that people want what you're selling, to how to sell it, and 3, money, so you can become a natural salesman. Then we're going to get into the clinical pieces so that you know how to craft a protocol based upon blood work and the foundations of medicine, so that no matter what your scenario is, you can feel confident in a one-to-one scenario, in a DIY program, or even in a new group program. That's all in the sprint. So go to sprint.drkylieburton.com. If we have transferred to our new website, you'll find it at foundationalmedinstitute.com. And last but not least, number 3 is our silver collaboration, where this is for people who are serious about running a virtual business. It comes with tech, it comes with automations, it comes with a 12-month coaching platform, it comes with 3 turnkey programs that you can implement into your practice, into your new business immediately, and so much more. So go apply at collaboration.drkylieburton.com. Again, if you're not seeing it there, go to our new website, foundationalmedinstitute.com, and you'll find it there. Okay, so 3 ways to come join Foundational Medicine Institute right now so that you can start transitioning to foundational medicine, making your life super duper easier, and solving more problems along the way. Join me live at next.drkylieburton.com. That's free. The sprint at sprint.drkylieburton.com, or apply at the silver collaboration, silver.drkylieburton.com. Nope, I lied. Collaboration.drkylieburton.com. See you soon.